Now, we just talked about the pancreas, right? We talked about the pancreas and insulin and glucagon. That example that we showed you shows how things are supposed to work in a normal situation. But sometimes people get sick. Sometimes people have a disease called diabetes. Maybe some of you guys have older relatives that have this illness called diabetes. So if you look over here on the right, you'll notice that there are some people here, and what are they doing? They're checking the amount of sugar in their blood. Maybe some of you guys have seen people checking their sugar. So what do they do, right? So this person at the top is using this little device that's going to make a tiny, tiny little cut in their finger, right? So you're going to make a tiny little cut in their finger, and a little bit of, a drop of blood comes out, and you can use this sensor to pick up this blood and figure out how much sugar is in your blood. And so you can figure out, look, the level of sugar is too high, or the level of sugar is too low. So people use this to monitor the amount of sugar in their blood. So maybe some of you guys have seen something like this. So people do this when they have a condition called diabetes, right? So what is diabetes, right? Let's go back over here on the left. So again, this yellow thing over here is the pancreas, and it's releasing insulin, right? Why is it releasing insulin? It's releasing insulin because there's too much sugar in the blood, right? So normally what should happen? The insulin should work and bring the amount of sugar back down, right? But what happens in diabetes? What happens in diabetes? So what happens in diabetes, right? So there's two different types of diabetes, type 1 diabetes and type 2 diabetes. So in type 1 diabetes, the pancreas doesn't produce any insulin, right? So basically the cells in the pancreas that produce insulin, they get destroyed. And so the pancreas cannot produce any insulin. So when the level of sugar in the blood starts to go up, there's nothing to bring it back down, right? So that's one type of diabetes. Type 2 diabetes, right? What happens in type 2 diabetes? In type 2 diabetes, the pancreas is producing insulin, right? Let's say the amount of sugar in the blood goes up. Well, the pancreas makes insulin to try to bring it back down to normal. But in this case, the insulin stops working. The cells that are supposed to try to bring the glucose back in order to lower the level of glucose in the blood, they stop responding to the insulin. So the pancreas is making insulin, but these cells are basically just ignoring the insulin. And so the amount of sugar in the blood stays high.